In this edition of Living Well Patient Stories, Neurospine Center patient Archie Roberts tells us how neck surgery helped him become pain-free and improved his life.
A little over a year ago, I went to see my regular physician complaining about a pain, tingling in my shoulder, and when I moved my head to the left, I get a little pinch in my neck.
Mr. Roberts presented to clinic with a long history of neck and arm pain, involved his shoulder.
Well, there are two things. One was the pain, like you're sitting in your truck or your car and you want to clear yourself. When you turn your head, you had the pain. And what really kind of concerned me was the tingling. It would tingle down my shoulder and down my arm.
The thought was alleviating that pressure would help his pain and get him back to normal quality of life and normal activities.
There was a disc between C3 and C4 was actually sticking out into my spinal cord, and that was what was causing the pain. And Dr. Hargett said, you know, when you're ready, we'll take that out of there, and explain to me the procedure.
So through a small incision on the left side of the neck, God made a perfect corridor down between our breathing tube and our pulse that we feel, and we can approach the cervical spine and remove the entire disc. That helps alleviate the pain.
I had absolutely no problem with the surgery. The surgery just went very well. The healing just healed right up. Like night and day between the day before the surgery and 2 or 3 days after the surgery. And I had absolutely no problem with it. The tingling was gone. I could turn my head with no pain.
Once a patient goes home from a procedure like this, you know, aside from the couple weeks of taking it easy, that's the goal, is getting folks back to a normal quality of life and normal activities as quickly as possible.
He was interested in my recovery, not in his surgery. And for that, I think I will always respect Dr. Hargett and would go there if I needed something.
Couldn't ask for the case to have gone any better. I got a great decompression of the nerve root, and his procedure went off without a hitch. So that always helps in patients' recovery.
Dr. Hargett was extremely professional, very personable young man, and obviously a very well-trained surgeon.
It's extremely important that we relate to folks on their level and explain procedures to them accurately and in a way they can understand, and showing films and pictures always helps as well. But that's extremely important in setting up how patients will be cared for through their experience.
If I ever had any problems again, Dr. Hargett's the first place I'd go.